while COVID-19 may be a trigger for people to seriously think about health insurance, but to move beyond that and to reiterate the point that you've been making for many, many years, the importance of health insurance. What is a reasonable cover according to you that people must start with? You can, of course, keep building on it as you go along, depending on your income increasing and your affordability increasing. But what's a bare minimum, according to you, that every individual must consider as a health insurance policy?
I think, thanks, Vivek, because firstly, as you said, buying health insurance itself is very, very critical. So for people who haven't bought, please do, buy. And I'm sure you would have realized in these times, trying times, that it is very important. When you buy, we have seen in the past a problem of underinsurance in India. So people will, buy a cover of 1 lakh or 2 lakh and feel that they are safe. I sometimes feel that that's even a bigger mistake than not buying insurance policy, because at least if you don't buy, then you might be preparing for some other funds to take care of that a healthcare event which might be unforeseen. But if you end up buying and have just 1 lakh or 2 lakh 3 lakh coverage, you might feel, oh, I'm insured, and you may not really prepare for the contingency for a health event. So today, in a many ways, government itself, through the flagship Ayushman Bharat scheme, has set the tone and the standard, where they say 5 lakh coverage, and that too for people who are underprivileged, who don't who probably don't have ability to pay for that, and who will get covered at a very, very well negotiated cost by the government and government hospitals and even private hospitals. Even there, the minimum coverage that the government has said is 5 lakh rupees. So I would say that for any other person who's buying policy on their own outside of the Ayushman Bharat scheme, there is no reason that it should be in any way less than the 5 lakh coverage that even the Ayushman Bharat scheme covers. And therefore, I would say that it should only be higher. Sometimes some people feel that, oh, I'm staying in a tier 2, tier 3 town, therefore the healthcare cost here is much lower, so maybe I can do with lesser. No, that's not right, because when unfortunate healthcare event happens, you want to get covered in the best, or treated in the best hospital in the country. So you might actually go to the metro cities, or where the treatment facilities are best, and there the cost will be higher. So I would say 7 to 10 lakhs is typically where it should be. But having said that, minimum 5 lakh, please, nothing below that. And as your paying ability increases, as you can find some ways to pull out some money towards health insurance, keep increasing that. As your family size increases, please keep increasing the coverage, because there is a family floater. You can always get the benefit for the entire family coverage, and the cost is not too much for people to think about. 15,000-20,000 rupees an annum is not something that I think today we cannot afford in the country, because for the people who cannot afford, Ayushman Bharat scheme is in any case there. So I would say minimum 5, but typically as the family size increases, 7, 10 and more is where we should start looking at. And don't just see this as a cost. It is actually a peace of mind. It is a transfer of your risk to another, specialist and expert organization, which will then give you that comfort that if anything happens, they are there for you.
It's been a pleasure talking to you. Thank you very much, Mayank, for joining us and sharing your thoughts and educating our viewers in difficult times such as these that we are living through. Thank you very much.
Thank you, Vivek. And I'll just say, stay home, stay safe, and stay healthy, please.